There's several different types of facelifts that are performed in the field of facial plastic surgery. The name of the facelift really depends on the area of the face that's being addressed. For example, in my practice, I refer to the mini lift as the facelift that addresses the lower part of the face. The mini lift takes care of the jawline area, and it also takes care of the neck area. In other words, it takes care of the lower 2/3 of the face. A brow lift addresses the upper third of the face, and as the name implies, the brow lift actually elevates or repositions the eyebrows. When you combine the brow lift with the mini lift, this is what I call, or what I refer to as, a full facelift in my practice. Within the different categories of facelifts, the technical definition of a facelift really depends on how the muscle layer in the face is addressed. As we've seen in earlier videos, one of the components of the aging process is the fact that the superficial muscle in the face and the neck follows the direction of gravity. As that muscle falls down, it stands to reason that any procedure that would reverse the effect or the descent of that muscle would change the position of the muscle in a 180-degree or an opposite direction. The facelift that I perform is an extended facelift, which means that the results are going to last for a longer period of time, whereas a regular facelift would last maybe 2 to 3 years. When we address this muscle in a certain specific way, the results are going to last a lot longer. We really don't define what we do according to age. I rarely ask patients their age. What I'm interested in is the patient's concerns and whether those concerns have a legitimate, natural, and long-lasting solution. The other component of age is medical health. And as a surgeon, one of my biggest concerns is the patient's general medical health. Can that patient undergo a procedure under twilight anesthesia dependent on their health? And that's the question that I have to ask. So every patient that we operate on has to obtain a medical clearance. With regards to age, one of the other issues that comes up is whether a patient is healthy enough to undergo a cosmetic surgery procedure. We all know the 45-year-old patient that has many different medical problems, for example, heart disease and diabetes, obesity, those kinds of medical problems. And that's a patient that's at higher risk than a 70 or 75-year-old patient who is thin, has excellent medical health, has always taken care of themselves. And so age is really a relative function that really depends on medical health. The types of problems that are addressed are the same. We take care of tissues that fall down due to gravity, whether the patient is 45 years old or whether the patient is 80 years old. So really, excluding the medical health component, what we really base our decision to have surgery on is whether that patient has the indication to have surgery. The recovery process for aging face surgery is fairly straightforward. All of my patients return to full, strenuous activity at 2 weeks after surgery. Patients can return to the gym. They can return to any sort of activity that they want 14 days after surgery. Short of that, it's what I call social recovery, and that's really the most often asked question by patients. Patients ask, when can I go out to dinner with my husband? When can I return to work? And people really won't see the bruising and the swelling. I tell people, generally speaking, that's 7 to 10 days after aging face surgery. Should there be any bruising or any swelling, it can be covered easily with cover makeup. The entire recovery process takes months. However, the results come to the forefront usually between that 10 to 14 day window, and that's when patients can look in the mirror and see the difference, and they can understand why they did the procedure that they wanted to have done.